Someone wants to know if this was already tried on people who had hair loss due to chemo.
We don't have any experiment for those people because it's a very new technique for hair grow. Um, but the thing is, for example, we use Plexr for like psoriasis. We use Plexr for dermatitis, for eczema. So one of the things that plasma does to the skin is it revives and rejuvenates the skin, you know? So then the mechanism of action of Plexr for hair grow is basically three things: activating angiogenesis and blood circulation, which is the main thing that you want to happen. And then the second one is the biostimulation of the follicle. And the third one is it is antibacterial and fungal. So these three mechanisms of action, they also help for after chemotherapy, but you need to make sure that because after chemotherapy, the healing power of the body is gone, kind of. So you don't want to use cath resurfacing or ablative. If you want to do something, it's going to be just Plexus shower. Dr. Crowley can complete
Yeah.
that.
Yeah, so I don't think the thing is, it's not going to, obviously the mechanism of hair loss and chemo, it's not going to reverse that. So you're not going to use that in an active patient undergoing chemo. It's not going to mitigate hair loss from chemo or help that. But when they're completed their round of chemo, that is when we can try to speed up the process. So as their hair is starting to grow back, certainly I would feel comfortable using this technology. No, there's not studies on it. But we've treated post-chemo patients in our practice definitely for a while now with a variety of techniques to support hair growth and to support that process of them growing their hair back. You want to make sure that they definitely are not going to heal wounds normally, right? Their body's ability to do that for a long time after chemo. So somewhere, a minimum of 6 months to a year, that process is going to be impaired and maybe even longer. Um, so hair is a tricky area to treat. And one of the things that I see, regardless of whether you're using injections, topicals, Plexr, micro, any of those things that you're using, if you haven't addressed underlying causes of the hair loss, none of those technologies are necessarily going to be effective. And so when I say that, along with chemo, but you have a lot of other deficiencies. So you can have vitamin deficiencies, you can have abnormalities and different sorts of, your thyroid function, your B12 level, your hormone levels, all of those things will impact your hair. So this is an effective mechanism that I would use to stimulate moving hair from the resting phase and the more active growing phase, and especially after they shed all their hair from chemo. But don't forget all those other things that are going to go into it. We could do a whole session on just hair alone,
Yeah,
because a lot of things that factor into that.